Definitely be bringing you the details of this story and many more others in our subsequent bulletins. Let's now switch to matters health, where the Center for Health and Human Rights Development and other partners have raised concern with underfunding to critical aspects of health in the draft budget of the financial year 2023-24. This scrutiny is on the ministerial policy statements revealed under-planning to the areas in human resource, in the health sector, drug supplies and equipment of health facilities, and that's across the country, and therefore calling for revisions. Let's now get joined on Quecken's side by the Programmes Coordinator, Advocacy at CEHURD, Eceru Peter, to let us in on what you think, Peter. You highlight the staffing challenges, which has been like a song. And when it comes to health, at what points does the budget fall short? Because yes, we know that human resource is very, very key.
Thank you very much, Mildred, for hosting me. I think overall, over time, we've consistently had a challenge with financing for health. And at some point, we had reached about 9% of the national budget going to health. But over time, we are rolling back achievements that we made as a result of this allocation to health. And we have begun again to roll backwards. We moved to about 8.1, 7.2. And now if you look at the proposals for 2023-2024, we are dropping down to about 6.5. And this is specifically worrying. And this, you must take into consideration a number of other macroeconomic factors. For example, if you look at our population is growing at about 3.4% annually. And that means that you have more young people coming into the population and desiring health services that they are not able to get from the government. But it's also important to note that the Ministry of Finance indicates that the shilling will lose value against the dollar. So for things like medicines that are largely imported, we'll have challenges. 90% of medicines that we use as a country is imported. And once the shilling loses value, it means that even if you retain the same amount of money that we had last year for medicines, you will now buy lesser drugs.
Now, Peter, does that then spell doom for drug stockouts? Because that's become another synonymous aspect with our health systems. But also, what do you think about the operationalization of the National Ambulance Scheme? Because we have aspects and issues with ambulance systems in the country.
True. The stagnance of the allocation to national medical stores for procurement of drugs will certainly mean that the shortfall for drugs in health facilities will even get worse as we continue into the coming financial year because of the limited resources. For essential medicines and supplies, we have a shortage of about 245 billion shillings. And most of this is in Health Center 2, Health Center 3. That's where most of, about 71% of outpatient people go to. And so that means that we will continue to have huge, huge challenges. Now, in terms of the National Ambulance Service, it is a challenge for mothers especially who want to get to a public health facility to get there. We conducted a study which actually discovered that most of the mothers get to a public health facility using a border or walking to a health facility. And these are not recommended transport methods for a pregnant mother. And it gets worse when it is in advanced stages or when there are complications. So at that point, you really need an ambulance. Rwanda has implemented a very functional ambulance service. And Uganda also has policy that envisages that we have a national ambulance policy. But the challenge is that in terms of practice, we are not allocating money. We continuously keep National Ambulance Service as an unfunded priority. We believe this is the time for Parliament to say we need to start making baby steps, have a few ambulances as we continue to build a functioning system.
All right, thank you very much, Peter Eceru, the Programmes Coordinator Advocacy at CEHURD. And it's interesting when you talk about unfunded priorities, because that's become another song for all the country. But we hope that they can slip out of unfunded to funded priorities, because they already exist in the priority list of the country. Now, moving from health and talking economics,